Hi, everyone. Thanks so much for joining us today. This is part 4, or the 4th webinar, I should say, for our 2020 Practice Comeback Plan, where we're looking at key steps to succeed during and after this COVID-19 crisis. I know a number of you have joined us for the last 3 webinars, and we're glad to have you back. For some of you, this may be your first one, or maybe you've listened to the recording. Welcome. We're glad to have you on today's event. We're going to jump right in here with some quick introductions and housekeeping items. My name is Leah Chatham, and I'm the Director of Content Marketing here at Solution Reach. I've been working in healthcare and healthcare IT for a little over 20 years. 15 or so of that has been doing education for providers and their staff on practice marketing, patient engagement, practice management, all kinds of topics. And then I did spend about 5 years doing patient engagement and marketing for a small integrated health system with about 20 providers. So I've got some boots on the ground experience when it comes to dealing with patient communication and patient engagement strategies, which I hope will be helpful. And then I'm joined by Addison Reed, who is our beard-bedecked customer education manager. You can see him there with his happy smiling face. He does a lot of our awesome customer education content for the community here at Solution Reach, the knowledge-based articles and videos and webinars like this one, and we're lucky to have him. He also has been an office manager and has some great insights to share as well. So before we jump into all that content, I do want to make sure everyone knows that we would love to have your questions as we're going along today, so please feel free to enter those in. We'll try to kind of answer them as we go, and then if we've got a little time at the end, we can grab any last ones that might be outstanding. Click on the arrow next to questions and click down, drop in your question, and we'll try our best to get to those. This is also a good place if you're having any, issues like sound. I've already had a couple of people drop that in. I'm going to push out a chat message here. So if you are having trouble with your sound, a lot of times the cause for that is being on computer audio. So just try switching from computer audio to telephone in the audio option. And that often is the best way to resolve that. Lee says that's what we see generally, is that tends to be the problem. It's a bandwidth issue. If you're having support-related questions, we would encourage you not to put those here, but to take those to community.solutionreach.com, click on My Support, and chat with one of our support reps, or email us at community@solutionreach.com. I'd also encourage you to consider just dropping your question into the search bar there in the community. Often you'll find there are some great articles and resources. As I mentioned, Addison is your guy there. He really creates a lot of great content, so definitely worth checking that out. Also, a couple other quick common questions. We will be providing the slides and the recording to you via email later. You can also, I believe that'll also include a link back to the other webinars if you haven't seen them. You can also, I think, get those. Addison, are those on the website somewhere that they can go get those too? I've had a bunch of people asking about that.
The links to the webinars you're saying?
Yeah, the past webinars. Is there a place we can send
yes.
them, or are they just providing that in a link?
Yeah, so sorry, I cut out a little bit on my end, so thanks for catching me up. You can go to community.solutionreach.com. At the top of that page, there's a resources link. You can click the resources link, and one of the sub items on that little drop down is for the webinars. And you can go to that webinars page, and that has all the past webinars that we've done. It's going to have this one when we're done, and we load the recording up there. So yeah, you can wait for us to send it out to you, or you can check there usually about a day after the webinar.
Awesome, thank you. I could not remember where we had put those. We've been obviously providing a huge amount of content and in a very short period of time to everyone, trying to really pivot everything to help you guys address the COVID-19 crisis. And I'll tell you, my brain isn't what it used to be. So, okay, moving forward, let's look at our agenda really quick, and then we'll jump right in. We are going to be talking a little bit about developing written plans to deal with some of these things as we move forward, making sure you have contingency plans in place. And then we're going to talk a little bit about some of the tools that are available to support you during this time. And of course, doing some Q&A during the presentation as well as towards the end. So again, just make sure you're dropping those questions in the question bar, and we'll do our best to get to as many of them as we possibly can. So contingency planning. I know this may not be something everybody wants to be thinking about right now, but actually it's probably one of the most important things we need to be thinking about right now. We are hearing from quite a number of infectious disease experts that there is likely going to be another wave of the COVID outbreak, and we are going to need to be prepared for that. A lot of people seem to be suggesting that that is going to happen in the fall, potentially maybe heading into the winter, and that we may see it in conjunction with the regular flu. There are some predictions about what that might look like in terms of perhaps hitting areas that were not hotspots before, but that maybe will be hotspots next. More likely to be in the interior of the country. Obviously these things are pretty heavily affected by things like how well various states have done in terms of implementing shelter-in-place orders and social distancing now versus later, or how quickly they respond if we begin to see another outbreak. It does seem like there's a strong possibility that we may see another resurgence, or we may see things fall off for a little bit and then surge back up in different areas that maybe weren't hit as hard the first time. So it is worthwhile to be thinking about contingency planning. How will you more quickly and effectively pivot back to, say, using telehealth? How will you take the lessons you learned from this process with you into the future so that you can do a better job, if this happens again? So we're going to talk a little bit about developing those written plans and thinking about the technology and services and how you can offer them in the future. But it is important to be thinking now about how you'll deal with that so that whenever, if it does happen, whenever it happens, you are already ready. I'm going to hand it over to Addison to talk a little bit about that, sort of developing your plan for the next 12 to 18 months. And Addison, it is all yours.
Awesome. This is something I've been very excited to tackle in this webinar series. I've been looking forward to this particular webinar, not just because it's the last one of this series, but there's just so much good content in here that I think is really applicable to help better prepare us. Like you said, if we do see something like this happen again, we see a little bit of a resurgence, we can plan ahead and be much better prepared than many of us probably were. So, like some of you remember from last week, Leia's favorite word is communicate, communicate, communicate. One of mine is flexible. We've talked a lot about flexibility from the standpoint of your patients as well as your staff. So with this in mind, things, they may change quickly, like they did, like we saw just, a month or two ago. So you need to have some things in place in your plan that help, answer these questions. What if you get sick? What if you lose staff members? What if they're, they go to other places of work? What if your area is hit really, really hard by one of these resurgences? And with that in mind, you need to develop as many backup options into your plan as possible, or where applicable. Like we have here, maybe you have a plan A and a plan B, but maybe a plan C is necessary in some instances. So that's kind of the big picture that we want you to have in mind with some of these different things that we're going to look at today. So one of the first.
Oh, Addison, can I jump in really quick as we move, before we hop in, and I'll put the next slide up, but really quick, I just want to mention, I know we have some group medical practices probably on the line today who may find themselves dealing with some of this. And one of the recommendations we've been hearing from some of the really large groups, especially in the New York, New Jersey area, is that they created a task force, really as soon as it became clear that they were going to start seeing patients potentially with COVID. So if you are a larger group, even if you're a smaller practice, you may want to get your staff together and create a little team to brainstorm. But especially if you're a larger practice and you're likely to end up seeing patients during another outbreak or something like that, you might want to create a little task force that can kind of digest all of the information and all of the feedback and really make recommendations, just by way of a quick note there. Sorry, I'll hand it back.
No, that's actually a fantastic recommendation. I mean, some of the things that we've covered in previous webinars during this series are, you might have to do things that you've never done before. To that point, you may have never created a task force. You may have never needed to. But again, this is a good time to determine the needs of your practice. One of the first things that you may want to look at are, what are the lessons that are hopefully really present in your mind right now? What are the things that you learned just in this past month, in these past few weeks? Look at how you initially responded, how your practice responded, how your patients responded. Were there any weaknesses that you can identify just looking back? Right, that hindsight is 2020. This is a fantastic time to make use of it. And along with that, we're going to talk about some different ways to collect feedback from your staff and from your patients as we move through this. So with that in mind, this next slide actually has an example of a direct survey you can send out to patients right from the Solution Reach platform. And this is again, a great opportunity to ask some of the questions that will help you formulate your plan and make it as effective as you possibly can. So whether it's things like asking your patients, how well did we do in communicating about our hours or our availability, safety precautions that we're taking, any changes to the intake process, any specific ways the virus may impact you personally as a patient, ways you can stay safe and healthy, as well as provide an opportunity for patients to ask any additional questions or to provide any additional feedback that maybe you didn't think about as you built this survey. And what this does is this helps spread some of the responsibility of creating this plan to those who are also going to be affected by it, to your patients. So you sort of bring them into the loop, and you can get some different data points from them as you figure out what needs to be in your long-term plan and how best to accommodate some of those concerns. So we want to look at a few of the different common challenges to consider. We're going to dive into these each with a little bit more detail as we move on here. But supply shortages. This is something that we're seeing a lot of questions come in from customers, from non-customers. They're asking, where is everyone getting their supplies? We're waiting on a box, or we're waiting on a shipment, whatever it may be. What about remote care? Are you trying to provide more opportunities for your patients to provide options through telehealth? What about any practices that have just tons of paper floating around? Are there any options to reduce the amount of paper and therefore reduce the amount of things that need to be touched and in contact with patients and with your staff? And anything that can help streamline processes. And then, of course, regarding the communication with patients again, how did your patients feel? How do they feel? Do they feel well informed? How do they engage with the communications that were being sent out from your practice? So with that, let's look at stocking up on supplies right now. We know that this is obviously you can't do business without PPE. You could. It'd be a bad idea. You want to keep you and your staff safe, and you want to inspire your patients by showing them you're taking the necessary precautions. Now, I've been in a situation personally where we had some sort of a shipment problem happen, and we had to look for some really unique ways to get access to PPE. And this is a great time to, again, kind of think outside of the box. If your regular sources are having issues with supply chain, you may need to look at other places. You may need to be a little creative. Whether it's communicating with your state health department, local stores, Amazon potentially, or other places that you can make use of reusable supplies where applicable. This is a good time to take into account those different things, because if a resurgence happens, which is what's being predicted, the last thing you want to do is to have to shut down again because you ran out of supplies. We're telling a lot of our customers out there, this is something to be considerate of right now, as many of you are gearing up and getting ready to reopen and start seeing your entire patient base for your whole host of procedures and treatment that you offer. Make sure that you have the necessary supplies so that you don't have this big, hooray, we're open again, and then you have to shut down because you've run out of things. We talked a lot about that last week, about maybe even getting to the point of rationing and figuring out how many patients can be seen with the supplies you have on hand. So that's a fantastic approach to take. And again, the whole mindset here is developing a plan, because you know that even if a second wave of this virus doesn't happen, something else will, right? It's inevitable, whether it's, it's inclement weather or something is potentially going to affect your practice. The way I like to think about it is, in our day-to-day at the practice, we just know that there is going to be a patient who cancels or no shows at the last second. But if we have a process in place, we can accommodate those situations. We don't have to instantly go into react mode and try to figure out, oh no, what do we do? When we have a plan in place, we can rely on that plan, follow the steps that we've laid out ahead of time, and we can act in a way that is much more meaningful. And that same principle applies here. So along with preparing, and making sure that you have the necessary stocks of supplies, look at some of the ways that you're allowing patients to interact with your practice and receive healthcare or receive treatment. Telehealth, this is huge. We talked about this 2 weeks ago. It was a very, very sought after topic, and we had a lot of questions come in. And this is still something that's kind of growing and moving, and it's a changing landscape. If you don't have a telehealth solution, we highly recommend you look into getting one, because this could mean the difference between seeing no patients and seeing at least some patients. I talked to a provider just the other day out in California, and they decided that they don't want to do telehealth, and they're seeing some of the repercussions of that. Rather than being able to see some of their patients for a handful of services and being able to at least get a couple of revenue dollars here and there from those appointments, they're seeing no revenue coming in because of how they're limited. So again, this is one of those questions. Maybe it's a hard question to ask, but you may want to ask yourself, would I rather have a little bit of revenue coming in and be able to treat a few patients, or potentially do I need to shut down entirely? So again, survey your patients who are being seen for telehealth. Or if you don't have patients who are being seen for telehealth because you don't offer it, talk to other people. I'm sure there are people around you in your social atmospheres that are going through telehealth appointments. Ask their opinions, get to know what it's like, talk to them about it. And Leah, I want to turn it over to you for a second to talk about SR Telehealth, which is our own solution for this.
Yeah, sorry, I kind of jumped the gun. Jumped forward too soon. Yeah, so obviously a lot of people are utilizing telehealth right now, and some people are using solutions that they had in place. But what we have found from conducting some research with our own customers and also from talking to some other experts in the area was really a very, very small portion, in the single-digit percentage, had some kind of telehealth solution in place prior to this. Most people who've implemented it did it, since February. Many are using solutions that they consider to be kind of temporary. So we very quickly worked internally with our product department to develop a solution we could roll out quickly to our customers that is easy to use. So it can be launched from SR Conversations, which is our two-way text messaging tool. You can launch it on demand during a text check-in type appointment, or you can pre-schedule and then text a link right before the appointment, and they can come in and do that. So this is secure, it is HIPAA compliant, it is high resolution, and it is free until July 31st. Because we developed this in response to feedback from people like you, we do want to try to get it out to people as quickly as possible and get people up and running if it's something that they need. I'm going to push out a quick poll here, just asking if you would like someone to follow up with you, so that those of you who've been kind of watching for something like this or needing something like this can get the follow-up here from Solution Reach pretty quickly. So just let us know if you want somebody to follow up and give you a call, and we will have them do that as quickly as possible, get you up and running on this. Again, it's free till July 31st, so hopefully if you're really in need of something kind of urgently, we can get you set up quickly and you'll have it available to you as you're kind of dealing with this immediate crisis. Just going to give it a couple more seconds and then we'll close that. Somebody's asking what the cost would be after July. So it varies a little bit depending on some different factors. When they call you, just have them walk you through that. Also, I know sometimes people have an issue doing the polls. We're not sure why. If you were not able to click yes in the poll, there's a survey at the end of the webinar that just asks generally if you want someone from Solution Reach to follow up with you. Just say yes in the survey and we'll make sure somebody does. All right, it looks like everybody is done doing that. So thank you. If you responded yes, we'll make sure somebody follows up with you. Okay, so moving on, I'm going to hand it back over to Addison to talk to you a little bit about other solutions to kind of help you with reducing the paper usage and being more digital.
Absolutely. So I previously shared this experience in a webinar earlier today, but I spoke with a good friend of mine who's an office manager right now. And I said, hey, Chris, how are things going at your practice? Are you able to see patients, things like that? He said, things were going okay. And then we ran out of paper. Their office is located in an area where everything is, everything except the bare essentials are open. And in that particular locale, there wasn't any place to go and buy reams of paper for their printer or whatever they were using. So he said, it shut us down because we didn't have a backup plan. We didn't have a way to print off our intake forms. We didn't have a way to provide statements to our patients. We didn't have a way to provide cost estimates. He said it was the biggest shock because that was the last thing we thought of that would put us out of business for just a few hours. They found something. They rustled up some papers from somewhere else. But he said it was a really big gut check for us. We had no idea that we were that reliant on paper. So with that in mind, this is something that you don't want this to happen to you and have this be the thing that potentially shuts down your practice for a handful of hours or days, the worst case scenario. So there are a few different ways that you can provide a digital experience to replace these paper-driven experiences. So the intake process, this is one of the very first ones that I can think of that seems to drive the most paper. At least it did at my practice. So we have a solution for this called SR Intake, which allows you to send those digital check-in packets directly to your patients. Now, some of the benefits of having a digital version of this, one of the first things that comes to my mind is it's way more convenient for me as a patient to fill something out from the convenience of my own home, especially if I can do it right from my smartphone. That is way more convenient than having to mentally prepare to arrive at the clinic and sit down with a clipboard and pen and fill out paperwork for 10 or 15 minutes. Another aspect of this is from the provider side. I can't tell you how many times we had patients fill things out, and patients don't always have the best handwriting. That's just the truth of it. And so you're sitting there trying to decipher these hieroglyphics of what the patient's name is sometimes, or their phone number, or the medications they're taking, as you try to transpose that into your EHR, your practice management system. So this can aid you in a few different ways, but the intake process as well can be a bit of a check, a bit of a pre-screening tool that you can utilize. You can ask any of those COVID symptom questions during the intake process. And if patients are indicating, I think I have some of these symptoms, you can tell them, hey, communicate with our practice, talk to us, give us a call. Let's make sure you're taken care of because we want to keep you safe. We want to make sure that the rest of our patients are safe. We want to make sure our staff are safe as well. Another option here to help reduce some of the unnecessary calls is to introduce a way for patients to schedule online. One of my favorite examples of this that is not in the healthcare space as heavily is, or at least that I think of should be in the healthcare space more, is when I go and fill up my car with gas. I hate having to walk in, pay the attendant, walk back to my car. It just is not convenient at all. I love being able to drive my car right up to the pump. I hop out, I pay, I put my car full of gas, and I'm on my way. It's such a convenient experience, and I don't need to interact with anyone. I can do it all myself. Why shouldn't that be part of the healthcare experience, especially when it comes to scheduling? So we have a solution for that as well. It's called SR Schedule, and one of the most common questions that we get about this particular product is, I don't want my patients to just be able to plop themselves into my appointment book wherever they like. And it doesn't work that way. That's the nice thing is patients, all they're allowed to do is request appointment times. They're able to see, some of the openings that you are allowing them to see in your schedule. They can request an appointment, send that request to you, and it's ultimately up to you. If you want to say, you know what, we'll accept this request, or if maybe you scheduled somebody in that time slot and you need to communicate back with the patient, say, hey, you know what, Mrs. Jones, we actually, that appointment spot was filled. Can we actually reschedule for a different time? So again, you have full control over that. But again, having that added convenience is really going to help, make it easier on your patients. The easier you can make things on them, the more they're going to appreciate that. Payment methods. Leah, I can't tell you how many paper cuts I had back in the day from sending out paper statements and the piles of paper that would surround me when it was statement day. I had to have, a nice big caffeinated beverage next to me to get me through the day.
I know. We talked earlier too about like even when you're using a service, it's like pulling teeth to get, make changes, get updates. Sometimes you're trying to send files and there's some kind of problem with the data. I mean, there's just so many things. I don't know. I could go on and on and on about patient yes. statements in general as a process overall.
Yeah, no, I
so
know.
many problems.
There are, and that's the thing is this is why it makes so much sense to have an option to allow your patients to pay for their healthcare online, or from the convenience again of their phone or their home computer. I mean, think about it. All of us are patients, right? But also all of us are consumers. I would bet many of us have probably shopped online at least once. We've probably purchased something from Amazon or from other websites, right? And it's extremely convenient. You do all of it right from your phone or from your desktop computer, and you pay from that same device. It's fantastic. So why, again, shouldn't that be part of the healthcare experience? This can reduce that paper. This can reduce the amount of, you need to, if a patient's in the practice, they have to hand their card over to you. You have to run it. If you can reduce the amount of things that people need to physically touch in the practice, that can help to flatten the curve right now, and it can help to flatten it should we see a resurgence of COVID, down the road here later this year. But again, adding some more convenience to your patients, especially in the area of allowing them to pay for the healthcare they're receiving, this is going to help increase the amount that you can collect from patients. If you have a lot of patients out there that you think, man, it is so difficult to try and get them to pay for services, this is one of those solutions you should probably look at. And Leah, I know one of the common questions that we get regarding payments is, well, what about having patients pay at time of service? How does that fall in? Could you speak to that for a second?
Yeah, so this seems to always come up, and it's interesting. I think that most people have a kind of a preconceived notion that using some kind of electronic or mobile bill pay solution is only for kind of after the fact, once you've gotten that sort of EOB or ERA and that patient due amount. But the reality is, you can use it at any time. So if you're doing a large number of telehealth visits and you're trying to make this entire process digital, you can send that request for a copay ahead of time. It does not have to be, way down the road. And frankly, best practices still apply. You really should be trying to collect everything you can collect at the time of service, whether it's a face-to-face visit or a telehealth visit, and obviously we know that's impacted by what kind of information you can get from your payers, but do your best. And definitely you can use those electronic solutions for, pre-collecting as well as post-collecting, as the case may be.
Yeah, and just to give you a glimpse of these three things kind of in action, this would be my ideal day as a patient, and this is from the patient side. If my provider was using some way to allow me to do a digital check-in process, request my own appointments, and allow me to pay online, from a patient standpoint, my ideal day would look like this. I would receive my intake packet while I'm still at home. I'd fill it out, and my provider would get that information. They'd say, hey, Mr. Reed, this is how much your balance is going to be due today. This is your copay. We're going to send you that payment request. I can pay it before I even leave my house to be seen for the appointment. And I get there, I arrive at the practice, and since I don't need to fill out paperwork, and since I don't need to pay, I've already paid, I walk in the front door, and I don't even need to sit in the waiting room. They say, hey, Mr. Reed, we're actually ready for you. Why don't we walk you back into the treatment room, and let's get you taken care of. And then my appointment happens, and when the appointment's done, they reschedule me for any follow-up that I need, and I walk right out the door because I've already paid. And if I need to schedule at, it's at my convenience. That, I have to now at a day. I'm at a day and age, and I'm at an experience and an experience. I'm in a situation with my family and with my work here at Solution Reach that I need as much convenience as I can get my hands on. So I go out of my way to seek providers who provide this convenience, because to me it shows that they care about me and my time when I'm outside of the practice as well. Okay, let's shift gears for a second. Let's talk about. Yeah.
Hey, Addison, really quick
Yes.
before we jump forward, I did want to mention another question that came up, and it's a great question, so I want to throw it out there. Someone said, well, how am I going to be able to collect anything if I can't see their insurance card because they're not there in person? And I just wanted to say that we strongly recommend that you have people send you a picture of their insurance card. You should be, if you're doing these virtual visits, you should be having people use their phone to snap a pic of that card, or if you're using SR Schedule, that's one of the things they can do in SR Schedule is snap a pic of their card. I was on a webinar earlier this morning where we were talking about telehealth, and the presenter, who is a really well-known expert in billing and coding, nationally, and has done huge amounts of work for groups like MGMA, said she had a telehealth visit this weekend. Actually, what she did was she used the camera on her computer, turned it on video, and held her card up front and then back, and then sent them a short video clip, which was actually a new one to me. I had not heard that, but it's a great suggestion. So if you are trying to create an all digital experience, there are multiple ways that you can get those insurance cards if you don't already have them on file, so that you can get that information to know what those patient due amounts are.
Yeah, okay. I want to add one more thought on that, because that's a fantastic idea, and it's a great question. Because this, when I was in the practice, this was so hard to get patients to get that info to us, and we would have loved to have it ahead of time. And so, the way you got to think about it is, again, this is a great time to make use of a two-way texting opportunity. That's what we're going to talk about on this next slide. But if you have a way for patients to send you that information and to do it in a safe manner, think about smartphones. Every patient out there with a smartphone, they have a scanner in their pocket, right? They can take a picture, right? It acts as it's a camera, it's a scanner. It can take a picture of that insurance card, get it to you, and you can move way more quickly and way more efficiently as you look up their benefits and whatever their coverage may be. So with that, on this next slide, let's move to it and let's look at this.
Now we'll move to the next slide. There we go.
So opening up these lines of communication, again, that two-way text is incredibly important. It's great if you have a way to send out text messages to patients, but it's an even better experience if they can initiate those conversations with you and they can communicate directly with you and send things to you like pictures of their insurance card, or other things that are applicable to their patient or their health. Opening up some of these different lines of communication, again, this is just going to add convenience. I know, Leah, you've mentioned this before, that we've sent out different messages to customers who have been on these webinars. We sent out the webinar material, and we get a lot of these auto reply emails that say, hey, thanks for sending us a message, we're closed right now. And they don't provide any information as to how to communicate with them in case of an emergency, or if you need to schedule an appointment of any kind. There's nothing, right?
I know. So, it's crazy. Yeah, it's hard. And you know what? There's one that comes up a lot that I always forget about, and people are always having to remind me, which is your voicemail message too. And I know we've talked about that in other webinars, but that's another one where people often forget to update it, and then people are calling you and it doesn't tell them, they have no idea if you're open or you're closed or what's going on. So it's just, important to keep in mind that you're providing some kind of and you can reach us in this way, or, here's how we're communicating with people.
Yeah. And if you don't provide, if you don't communicate with your patients and let them know how to communicate with you, if something comes up and they need to be seen, they don't know how to communicate with you, they're going to go somewhere else. They're going to find a provider that they know they can communicate with. So again, use some of this time to reflect and look back, ask your patients, make use of that survey, ask them what you can do to better communicate, during this current period, or if some other, type of crisis happens down the road. Ask your patients, get that feedback now, so that you can implement that into your plan, this long-term plan. Along with that, make sure you're collecting the right information. We saw a couple weeks ago that there are patients across all generations that prefer to be contacted via text. Now, there are still going to be patients out there that have a preferred method. Maybe they still want to receive a phone call, or they like email. That's okay. But you need to know what those preferences are so that you can communicate with that patient through their preferred method. That's going to make them happy. And happy patients typically, not a guarantee, but typically like to stay at your practice, like to stick with you through the thick and the thin, if you will. But again, take this into account. If a second wave of COVID happens months from now, how are your patients going to know that they can communicate with your practice and receive treatment or help they need in emergency situations? Encourage as much of that preventative care as well right now, so that if something happens down the road, their preventative care isn't further kicked down the road, right? This is a great time to educate. It's important to encourage, but if you can encourage with education and with helping these patients understand how their health is affected and how you can help them solve some of those health problems, this is going to, again, help them realize that they need to get in and they need to be seen. The education is really going to help with that.
And Addison, I do want to stop for 1 second because somebody has been asking about HIPAA compliance and patient communication. And I think it's so important anytime we have a chance to just kind of remind folks about this, that we should. There are obviously a lot of things around HIPAA and TCPA and CAN-SPAM. We do actually have a pretty detailed guide, as well as a previous webinar we did on solutionreach.com/resources that you can use if you really want to dig into the details. But the main thing is, and this is what's super important, you can communicate with patients through two-way text, and it can be HIPAA compliant. This is something that was announced at HIMSS by the Office of the National Coordinator. They verified it repeatedly over the last 2 years through many press conferences and national publications. As long as you have received patient consent, and you can do that through text using the basic text message that says, if you're using a not secure two-way text messaging solution, this text is not secure. We just need your permission to be able to continue to communicate with you. Once they have given permission, you are HIPAA compliant. So it's really important to remember that one of the challenges that we've been seeing a lot, and that the HHS has really been trying to address, is often people tend to go to kind of the most extreme in terms of trying to be HIPAA compliant, to the point where, in fact, they might actually be violating HIPAA by not providing access to patients. So I would encourage you, if you are worried about, being HIPAA compliant, but you want to be able to ensure that you are doing a good job with your patient communication, to look at some of those resources and really understand you can communicate with patients via email, via text, both secure and unsecure, as long as you follow some very basic guidelines. And many of your patients would like you. We've done some research on this. About 2/3 or more of your patients would like you to offer the ability to communicate back and forth via text. They would prefer it not be something where they have to sign in, download an app, do a whole complicated thing. You can do that and be compliant. Also important to remember that patients are not covered entities under HIPAA. They can send you anything they want. So it's totally fine for patients to be sending you PHI. And as long as you ask them for their permission to continue that conversation, you are being HIPAA compliant. So I know people get very nervous about that and worry, and we've had some people on here saying it's not compliant, I can't do it. You can, and it's very easy to make sure that you stay compliant. And it's really important to remember that, the priority is being able to communicate and engage with patients and get them the information that they need, and there are ways to ensure you can do that while remaining HIPAA compliant without taking on, a huge burden. So I just wanted to say that before we move on to the next thing.
Leah, this is why I love having you on this webinar, because you are a wealth of knowledge. That is so incredibly important to be on the up and up with that. And to whomever is asking questions like that, or has those concerns, from a patient standpoint, thank you. Thank you for being
Yeah.
concerned about your patients and for wanting to make sure that you're helping to keep their information private. I really
Yeah.
appreciate that personally. So thank you for that.
Absolutely. And I think it is super important. But it is just as important to remember you don't want to go to such an extreme that then you've made it harder, on patients too. So you always want to be balancing the importance of, making sure patients are getting the care and the service and engagement that they need with with compliance. And as a vendor who does this every day, we can help you with that. And then we can help support you in making sure that you can do both those things.
Absolutely. Well, we talked
Okay,
a lot
so,
about. Go ahead.
I was going to say, so moving on to the next slide.
Yeah, I was going to say,
let's
shift gears a little bit. Yeah.
Plea about the compliant text messaging.
So even, it's obviously very important to take into consideration, like we've talked about in previous slides here, how we're communicating with our patients, the feedback we're getting from them, and how we are making them aware of our efforts during this time and during times moving forward that may be a bit of a crisis. We need to take into account our staff. Got to address the staff needs. So whether that's taking into consideration the individual staff member, right? You have a team of people, a team of probably incredible people that you work with, and they are from all they have all different sorts of situations. They may be single parents, they may be caregivers to the elderly or others who are in high risk conditions, or even something else that may not even be on this this very short bulleted list. Take into consideration their needs and their situation. If there are members on your clinical team, for example, that are high risk or have close interactions with family members who are high risk, this may be a good time to cross-train them on some of the things that your administrative team does. That way, this individual can work from home, but they can still contribute and help your practice to succeed. You may look at developing specific teams that are, if there's someone that can work from home, maybe it's your billing coordinator or a scheduling coordinator, have them work from home. Reduce the amount of people that need to be there in the clinic or in the practice. And along with that, you can go even a level further. We're seeing a lot of our customers do this. They are dividing their teams so that, and using them to work in shifts so that if something happens, if someone is exposed to, COVID-19, it's very limited as to who is affected in their staff. And this, again, this can help to avoid any overlap, of exposure. So there are some different ways you can do that and address some of those needs. And again, don't overlook the emotional needs. It's very stressful for many people out there who are, especially in some of those bigger cities, who are getting, really hit. This is a time to take into consideration the stress levels of those individuals as well as yourselves if you're in those areas. Provide ways so that your employees can learn how to manage that stress now and plan ahead for it in case something like this happens again. Plan ahead, have the resources in place to accommodate these situations. Get those employees involved in developing this plan that we're talking about right now. This should not be one of those situations where, well, I'm the office manager, so I'll develop everything. That's a terrible idea. Get everyone involved. Get the entire team involved, or as many people as you think are necessary. But the more voices you can have, the more people on your staff are going to feel like their opinions and their thoughts and their concerns are valued and taken care of. Now, another thing too is be as transparent as you feel is necessary, because when there isn't enough education or there isn't enough transparency, that's when rumors start. You want to squash those rumors. You don't want to have your work environment be a toxic place. You want your employees to be happy and to know what your plan is in any given situation. Again, this is just gonna, a lot of us, this is my mindset. A lot of us spend more time with our coworkers than with our own families. So we need to treat them like families to some degree, right? Have some of that open communication. This is another great example. Do things that are going to help boost morale, whether it's team activities or, maybe you're doing a team lunch and that's when you're also taking time to have a team meeting. Maybe it's a good time to start spotlighting employees and the efforts they're doing each day or each week. If there are employees that you've deemed, hey, we want to have you work at home for a period of time, make sure you connect with those employees. Don't let them feel like they're being forgotten simply because they're not on site as often. But again, do whatever you can to help solidify these bonds and actually help team members feel engaged. So some of these things that we actually have been implementing here at Solution Reach, we've been doing some different quizzes or gathering recipes, or having opportunities to share fun photos of our pets or even childhood photos, just some things that are a little bit fun that have nothing to do necessarily with the healthcare side. It just is a great time to look at these different ways to, build that team and build the camaraderie, amongst yourselves. Leah, I'm going to turn over to you for a second because everyone's probably sick of hearing me talk for so long here. Let's talk about finances.
I don't think that's true. So we've been talking about all these aspects of kind of preparing and organizing, and this might be one of the toughest ones. But you do have to be thinking. I mean, I'm sure you all are thinking about your finances, but beyond thinking about your finances and planning and preparing, there is a piece here that's kind of about, making some projections and engaging your employees and helping them understand sort of where things stand. I know from having worked in a small health system to having worked with people who are in, single provider practices, people feel more or less, comfortable with sharing detailed financials. And we're not necessarily saying you have to go that far. But it is a good idea to really kind of do some projections about, if our revenue drops this much, or if our revenue is down this much over this period of time. Maybe you have a couple of different scenarios based on how things are looking in your area. What steps would we have to take? And to share that information with your staff. I think, one of the things we've been doing here at Solution Reach is having weekly meetings and talking about those kinds of things. What will we do in terms of cost-cutting measures, or what will we do in terms of, pay or whatever, just talking about different options related to different scenarios. And it's important for employees to understand what those scenarios might be and how that might impact their role. Also important to kind of engage them in that. If you're trying to brainstorm cost-cutting initiatives, or if you're trying to get a telehealth program up and running quickly, your employees can be a huge source of help with that. And then talking to them really about what you're trying to do in terms of looking at all the various options, like lines of credit or SBA loans. So here we'll kind of just talk about financial relief. There are a number of programs, as you all know. The first round of the Paycheck Protection Program went pretty fast. We are hearing that a number of larger companies are returning money that they took through that program. People have mixed feelings about that. Obviously, those companies are trying to protect jobs as well. But regardless, it means there's some money going back in for smaller businesses that may be available at some point. Also, they refunded, so there's additional money coming in right now for that, for additional loans. The SBA has its expanded disaster relief loan program. The Fed did a program that was launched about 2 weeks ago that also is a small business loan program. There are many states that also have state-based programs, grants and loans that are going into place, as well as some cities and counties. And there are some nonprofit groups that are doing loans. So there's quite a lot of options out there in terms of doing that kind of thing to look at. So just talk to your staff about here are all of the ways we're looking to try to kind of protect the business, protect jobs, keep ourselves going. Talk about things like, how you might launch more telehealth or other kinds of programs to keep money coming in, and how you'll really, and then programs like looking at what we've talked about around how to get up and running again. If that means, extending your days or adding weekends for a period of time to get in more patients, being able to get caught up with those patients, but that also means more revenue, obviously. So really discuss those things, and especially if you're looking at the health and wellness of yourself and of your employees, making sure that everyone feels like they can handle that, whatever those efforts are that you're going to be doing, engage them, make sure everybody's on board, everybody understands their role, and, feels like they're contributing in a part of the process, and nothing comes as a surprise. This is a hard enough time for people as it is, especially people who may have been experiencing COVID in their own lives with a family member or themselves or whatever the case may be. People who are right now, at home, maybe trying to work part-time plus taking care of kids, it's stressful. So, surprising people with major life changes is not a great idea right now. Better to really engage folks from the get-go. Speaking of, it's kind of heading into growth mode here. I'm going to hand this over to Addison just to talk for a minute about some of the things you may want to think about doing now to support ongoing growth down the road.
Absolutely. And these are some of the things that typically get kicked up to the back burner because we're so darn busy in the practice that the last thing we're thinking about is maybe our social media or our website, or maybe we've heard of these terms, this SEO and this PPC. What are these mysterious terms? This is a great time right now to take into consideration what these are and how these may affect your practice. But along with that, moving forward, these are the ways that are going to help you stand out from your competition and from other providers in your area. The social side, many of you probably know, well, we probably need to have some sort of exposure on social media. This is a great time to start a Facebook page and to start engaging with your patients through that medium, and letting them know that you're now in that space and they can communicate with you through that medium. Maybe it's a good time, not maybe, it probably is a good time for many of us to look at our own websites and see what needs to be updated. I think of a provider I looked at recently. I was talking with their staff and they said, our website, we have photos of our entire staff. And I looked at it and I said, oh, this is great. So of everyone in this photo, who still works there? It looks like it was taken a few years ago. They said, well, 2 people work here. And it was a staff of about 18 people. And I thought, you got to get that updated. If people come in here, they want to see the faces they're going to be seeing there in the practice, right? Take some time to, not just the photos, but other things. Maybe it's forms, or maybe the look and feel. Make sure that your branding is consistent on your website in the same way that it's consistent there physically on site at your clinic or your practice. With SEO, this is search engine optimization. This means how easy is it for your patients to find you when they search online? Are you on the 3rd page of the Google search results, or are you one of the top ones? That's something to take into account. And another thing that can help get you out there for maybe they're not patients yet is pay per click. This is a way to get into the ad space or the advertising side of in a digital area. It's fantastic to have different physical marketing things in your locales, like billboards and mailers and other things, but you got to get into the digital space, and this is a good time to start looking into that and understanding that technology. On this next page, we actually have some links that you'll be able to click when we send out a copy of these slides to look into some of these different options of different companies that can help you in these areas. Leah, did you want to mention anything about this slide?
Just that we've kind of vetted these guys already. So these are partners of ours that we feel provide, a good service and can help you with things like social media or redoing your website or working on your online reputation. So if those are things that you need some help with and, you're ready to do that work right now, definitely a good place to look for that.
Excellent. Okay.
And now we'll jump into one of Addison's really favorite topics.
My favorite. So I know we kicked this webinar off with saying one of my favorite words is flexibility, but really it's learning. That's one of my favorite things here. And so we've talked a lot about communicating with patients and getting feedback from them and getting feedback from your staff and taking care of your staff and your patients' concerns. This is also a good time now, as well as moving forward, to sharpen the axe. Learn, and understand the technology that you are implementing. If you're starting to implement some of these digital processes, like a digital check-in or digital payment or digital scheduling or online scheduling, learn those technologies. If you're starting to offer new services, make sure you're getting, and learning as much as you can about telehealth billing and codes. That's a changing landscape. So take into account what that means and how up to date you need to be in that, that type of information. Look at what you need, the requirements to qualify for some of those government aid packages that Leah talked about on a previous slide. Maybe it's a good time to look inwardly and say, what do I need to become a better team member or a better person who leads a team there in the practice? Look at ways that you can really improve the practices you're already using and the processes you're using, as well as implement new ones to be as efficient as possible. Because when you can be efficient, your staff is able to work quickly and work smoothly, but it's also a very It's a preferred experience from the patient side as well. If I can go into a practice, excuse me, and my provider and his team, are working in a way that is very efficient, that instills a lot of confidence in me that I've made a good decision about who I have chosen to provide healthcare to me and to my family. So one of the things you can do is you can look at our SR Success Formula training. Now, this is training that we've gone really in depth on, and it shows you some of the different ways to reduce no-shows and cancellations at the practice, increase the number of appointments, as well as increase the amount of patients that you see. If you go to our community website, community.solutionreach.com, and you're logged in there, you can go up to the top of that page and click on our university. You can come in and take this course. It will take you less than an hour to go through this course. There are a few other courses in there that you can take as well to learn about healthcare communication, and we are working to make this university and make these resources available to everyone, whether you are a Solution Reach customer or not. Stay tuned because those updates are coming soon, and we are very excited for them. One of the other things I want to talk about is, we've talked about all these different things: sharpening the axe, learn, take care of yourself. It's a stressful time. There are a lot of different things going on. It's a changing landscape. Many of us are doing things we've never done before, or we're gearing up to do things we've never done before. Put your own oxygen mask on first, right? Just like when you get on a plane, you fly somewhere. That's what they tell you. Take care of yourself, because if you can't take care of yourself, it's a lot harder to take care of those around you. Manage your stress. Take care of your basic needs or the basic needs of your family. Access the help that you need as you need it. Be kind to yourself. I know some of this might be no-brainer stuff, and you might be thinking, Addison, why are you telling me this? I already know this. Sometimes we forget. Sometimes we get into the heat of the moment and things get busy and crazy, and we forget that we need to take a breath, step back. We got this, okay? You got this, and we are here to help you through this. This is not something you need to do alone. We can help you work through some of these concerns that you have in the ways that you're going to run your practice and run your clinics and help your patients. With that in mind, with one of the ways we want to help you, we've developed a practice comeback service. We provided all these different resources that we're providing to you, but we understand that even with all these free resources, it can still be a little bit overwhelming. So Leah, I'll turn it over to you to talk about this service.
Yeah, and I'll be very quick because I don't want to keep people past the time that we plan to have you here. But we have gotten a lot of feedback that people need more support. Some people are worried about struggling to be able to sort of create and reset up all the messaging that they need to do to get reopened. So we did develop a paid service that you can get. I'm going to push out a poll. Anyone who's interested in learning more about this, let us know, and we'll have somebody follow up with you. But essentially, the paid service includes having an assigned coach who will make a customized plan for you. They will work on confirming that your sync is working with Solution Reach and all the data is accurate. They will help with the setting up of all of your messaging, any updates or changes to templates and content, and the cadence of your reminders and all that kind of stuff. They'll also help you with setting up some group messages and newsletters. And of course, you'll have access to all the free resources that are available right now in terms of education and ongoing templates and things like that. So just throw your name in there. And if you, for whatever reason, can't click on the poll, or we close this before you have a chance to vote, again, there is an option at the end in the survey to say, yes, have somebody follow up with me from Solution Reach. I'm going to go ahead and close this. It looks like most people are done. Hold on, just let a big batch of people go in. Okay, there we go. Now I'm going to close it. Okay, if you still wanted to have somebody follow up with you, just let us know in the survey. So very quickly, I just want to close us up by reminding you that you will get the recording, the slides, links back to other resources, that you can go to community.solutionreach.com and access the previous webinars and resources. If you do want somebody to follow up with you on SR Telehealth or the Practice Comeback Service and you didn't get a chance to let us know in the polls, just let us know in the survey. The last thing I want to mention is that we are actually planning on one more webinar, which has come about because we've had so many questions on all of these webinars, and a lot of them have been great questions, and we really think more people probably have similar questions. So we are going to do kind of a Q&A format webinar in a couple of weeks. Watch for an invite for that. On your way out in the survey, if you have any additional questions you want us to look at trying to address there, there's an option to throw those into the survey. Also, when you get the invite, you'll see there's an option to send us any additional questions, and of course, we'll be doing some live Q&A. So our goal with this really is to provide one last webinar where any outstanding questions that have come in over these few weeks and the next 2 weeks, that we have a chance to try to give you more resources, answer those questions, and continue to support you through this. In addition to that, we do want to ask you too to share with us any other topics you think might be helpful. So in the survey, there's a question about that. If there are other things we have not covered in these comeback webinars that you think would be helpful for us to be thinking about developing content or webinars around over the next few weeks and months, please let us know there, and we will certainly take those into consideration. So our last slide is just contact information reminders. If you are a customer and you need to reach us with support questions or with questions about any of the products or any of the things we've talked about today, you can email us at community@solutionreach.com or go to community.solutionreach.com. If you are not a customer, we've got the number and the email here for sales at Solution Reach. You're welcome to reach out to us, and I will answer your questions or walk you through any products. So I just want to thank you, Addison, for all the great content and information and examples you provided today. It's so great always to do these with you.
Absolutely, and likewise, Leah. Love your wealth of knowledge.
I know, it just feels like such a great, like, oh, and remember that, you know, it's funny how you sort of trigger each other's memories about different tips and tricks and things to do. So, and thank you, everybody, for joining us today, and I hope you'll consider joining us for future webinars. Please stay safe out there, and we look forward to seeing you again on another event soon. Have a great day, everyone.